All right, what I want to do with you today for the next half hour or so, this is the same document that I posted on WebCat, and almost every one of you responded, I think, with thoughts about using the ethical decision-making model. I wanted you to talk amongst yourselves about the integration of ethics for our country, and tonight I want to run through a case with you just so that you heard my little blurb about using a model to help you make decisions. And then I have about 6 other cases, and I'm just going to divide you up and ask you to do a case on your own, following the same pattern that I showed you. This is one of the topic areas for teaching that I consider pretty close to sacred in social work, and I just told you that gray areas become even more confusing when you come to ethical decisions that you need to make. And probably the biggest, maybe the best advice that I can give you about making decisions in ethical dilemma situations is to turn to your colleagues, because you just don't want to be making decisions alone in this work. If we can help it, we don't want to do anything alone. We want to do all of our work with others. But when you're in a mess that involves you or a client or even a community, you want to turn to your fellow social workers and get their advice, get their help, in addition to the other steps that we're going to be looking at. Yes?
When I started my job out here where I'm at, I hated policies. I did not have a clue what policies are about, and I hated them.
Yes.
But now I've learned to love them because they cover my butt.
True.
And they steer me in a direction that may not ethically and personally be in my best interest, but it covers my butt.
And it keeps you safe.
That's right.
And if the policy does need to be changed, at least you've got something to begin with.
Yeah.
And if you can possibly imagine working in a situation somewhere that has no policy, which does happen, when places are really grassroots, they're just somebody getting started with great ideas, but you don't always have guides and rules. So that's the idea of this model. So let me talk you through just a few of the items on this page. This is something that I've used for years, and I won't go over all of this. But if you look at the definition of ethics, it's just the 3 words. And in my world, I would remember these 3 words because it might be on the exam. Ollie.
Yes.
Why do I have you presenting the grant proposal in room 150 of the Outreach Building on the 11th of December?
My goodness, I don't know why you do.
Well, let me ask it another way. This is where I get very obscure, and I don't mean to, but would you be able to imagine a reason why I would have you do a presentation in front of social work professionals in a large room that you've not had class in, and I've mentioned that you might want to dress up, and that you want to have a fact sheet or a brochure or media release available? Can you tell me anything about why I might be doing all this?
I would guess that you would have it be as realistic and as professional as possible.
Yay! That's a beautiful answer. Thank you. That's exactly right. And by the way, although you may feel a little bit of anxiety about doing this presentation, that's not the point. The point is not to upset you by presenting, but rather that physical environment, as you would have learned back in your human behavior coursework, physical environment matters. It's important. Just as true as some of the things Rhonda was sharing earlier about her work. How you talk to people is important, but the place where you talk to them is also important. Marissa and I actually had a fascinating discussion last week about this.